Many pet parents feel alone, especially when their pets are sick, conventional medication might not be working, and they're just watching their pets get sicker and sicker, going back and forth to the vet clinic for the same exact problem, and nothing seems to be working. You may be in that exact situation right now. And here's the thing, that's exactly where I was years ago when I found holistic medicine when my husband developed an autoimmune disorder. Through this path and this journey, even though it's been long, sometimes frustrating, and a lot of times I felt alone, this is the reason why we created some of the programs that we have to bring amazing pet parents like yourself together so that you have a safe community where you're not alone and able to get feedback and support and advice from a holistic veterinarian. Because let's be real, there's not enough people out there practicing holistic medicine. And so in this video, it's a snapshot of one of our amazing weekly Q&As that we do in our Blueprint program that just showcase how prevalent feeling alone is in this amazing holistic community. And we also talk about and break down one of our amazing member, Barbara's questions about her dog Kai, who's come a very long way with his gut health problems. And she's been with us since day one when the program originally launched. So I hope you enjoy this video and get a little snapshot of what it's like to be inside our personal, private, incredibly safe and open community where you can help your pets thrive naturally with natural remedies. I'm Dr. Katie Woodley, the natural pet doctor, and enjoy this small snippet from our Healthy Holistic Pet for Life Blueprint. Yes, Sarah, it is hard. I go through this too. It's a journey. Most people know the story of my husband here, an autoimmune disease, and there can be ups and downs with that battle. And it's really hard when you have like a bad day or a bad weekend or a bad week, and you're like, wow, nothing I'm doing is working. And so it's one of those, like, lean into the community, get support. The emotional support can be really helpful too. So you don't have to feel alone in managing this. And yes, it's a process as we heal our pets. I think most people here, like, raise your hand if you have a pet with a chronic health condition. Like everyone. And is it how you found holistic medicine? Yep. It's how I found it. So you're not alone, Jenny. We're here for you. So yeah, no, I appreciate all you guys. So it's can be hard, but we're all here together and doing the best we can and learning as we go. And every pet is a learning lesson, right? God, my pets have taught me so many hard lessons, I'll tell you that. So, but I'm grateful for the journey. I'm grateful that I found this path, even though it was a little bit hard. Had to go through losing pets to some really tough health conditions, but I'm so grateful I'm not stuck in that conventional world, because this is much more fulfilling and there's a lot more options on this side. So, all right. Does anyone have any questions or comments on that? It's frustrating. I mean, it's hard when, gut health issues, and Barbara is a pro at this with Kai. He has been a good learning lesson, right?
Oh boy. So just to help people who are going through this process, who haven't heard the story, just real quick. My last dog died from gastric carcinoma. And when I got this puppy at 9 weeks old, we quickly figured out there was a problem. And he was throwing up on a pretty regular basis, bile and gurgling stomach and diarrhea and dysbiosis and all sorts of insanity. And then I met Dr. Katie Woodley. And we started working together in October. I think he had just turned 1 at that time, right?
This is over a year ago, everyone, not this past
So
this has been a process.
He's now a little over 2. And it took some time. It was a trial and error and a lot of patience. But he's so much better now, except for this stupid poop that he got into and now has giardia, which I wanted to ask you a question about the quercetin. But it's, you have to be patient. And I think I've learned just over life, the quick fix with the pharma meds might feel good early on, but it's the long-term effects that you later on regret when you start seeing what happens with some of the meds. Not all, but some. So just to appease people who are struggling, because it can be hard. And I know I had a lot of crying fits, even on this screen. So with that being said, this guy was going through a similar phase this morning. He's got giardia. He started eating grass this morning. His appetite's been great. Poop was great. Threw up bile, and stinky farts now. So the question I have, though, that when you were talking about quercetin, that got my brain thinking, because I'm always kind of trying to figure out what the body's doing. Since quercetin enables the liver to release toxins, right?
Yeah.
And that in turn affects the bile production. Could that in turn also have the body throwing up bile to eliminate those toxins to a certain extent? Is that kind of what the process might be that's going on, where the body is actually saying, okay, I'm being stimulated to release these toxins, now I need to get them out? Or am I just simplifying it way too much?
It shouldn't create things coming out this end. The way, like if we're looking at the natural process of how quercetin works, and it's fascinating. I went to a Quicksilver all day seminar on Saturday. It was all about detox, and it was the most fascinating thing. I'm going to be reworking some of our environmental health module in the next few months, so stay tuned for that, to incorporate some of these. What is fascinating is that we have certain types of receptors in the liver cell. So we call that the hepatocyte. And what happens is when we have, so we talked a lot about, and for anyone where this is like, I have no idea what she's talking about, I talk about this in the gut health module and also in the environmental health module and the different phases of detoxification. So if you haven't gotten to that course area part or gone through that, just make sure you watch those videos so you understand what I'm referring to. What happens is that when we are processing toxins, a lot of the toxins are going back through from the gut in what we call enterohepatic recirculation. So they're going back through that, the portal vein back into the liver. So they're going through the bloodstream. And so what happens then, if they get into the liver cell and we already have an inflamed liver where it's already working over time, it's not processing toxins. Maybe we have things like glyphosate, we're using flea and tick products, we're feeding foods that have, potential like advanced glycation end products, like inflammatory things that are putting more stress on that liver already. Or we have allergies, right? It's processing histamine. What can happen is that chronic inflammation will actually downregulate the expression of these receptors that are sitting on the other side of the liver cell. So if you think about, okay, toxins are coming in from the blood, the liver cell's in between my hands, and they have to go through here and go through phase 1. So they're broken down by certain enzymes. They're cleaved into products that can be metabolized, broken down by the body. They go through phase 2 to turn into water-soluble toxins. If we don't have those enzymes, we talk about this like module 5, right? If we don't feed certain types of foods or things like that, that are actually going to, we're low in glycine, we're low in taurine, we're low in sulfurfated chemicals, a lot of times you're cruciferous. Those processes in the liver are not going to turn those toxins into what they need to. It creates more inflammation. Now on this side, so we have toxins coming in from the blood. We have the liver cell in here. There's a little liver cell. Over here is what we call the bile caniculi. These are all like the fingers that lead into the liver cell that are going to drain into the gallbladder. And then we form that's the bile that then gets expressed out into the stool. The bile is the detergent. So it's going to break down toxins. It's also the lubricant for the stool and to help move things out, get those toxins out. 80% of toxins are coming out through the bile. But if we have on this side, those receptors that these chemical byproducts. So the liver should be working through phase 1, phase 2, breaking them down, making them into tiny little particles so they can bind to these receptors to actually get out. If those receptors have been internalized because it's like, can't do it, we don't have the ability to do this, there's too much inflammation, that's exactly what happens. This is the down regulation of detox. So what does the body do? It goes, well, can't get out this way into the bile. We need to push those toxins back that way. Goes back into the blood. This is where your pets who have allergies a lot of times get itchier. You see detox reactions. You see the symptoms where we have probably bile, like vomiting bile. We should not see detox reactions ever. Detox reactions show us that those pathways are not working properly. So this is a common like misunderstanding amongst vets. Like, and this was a change. I was sitting there just mind blown. I was like writing down like cases and like thinking of you guys. And I was like, we gotta get this out. Like, that's what happens because we have these bile salts, these detergents being pushed back into the blood. So if you've ever, I don't know if anyone's ever like, you eat a meal and you get like, and it's probably not the healthiest. It won't be the healthiest meal. And you get itchy afterwards. Like, has anyone ever felt that? Okay, you know what it is? It's the toxins going the wrong way back into the blood. It's the bile salts. So extreme phase would be like jaundiced, right? We see the yellowing of the skin. Those are those bile salts. We're seeing the yellowing. That's severe, like the liver not working well, liver failure. But that's why it's itchy, because of the bile salts. So we need to make sure like that quercetin is helping to support that, but there's other parts of that pathway too. And this is where quercetin binding those heavy metals, it's an interesting, like the principle behind this company, which makes a lot of sense, which I'll be talking to you more about, and also revamping. A lot of it is already up to date in terms of like the phases, right? If we don't have elimination properly, we're prone to constipation. The bile can't get out. Those toxins are just going to get recirculated. That's why elimination is so important, phase 3. Making sure the kidneys are working well, because also those toxins are being dumped into the kidneys. Those kidneys also have the same receptors as the liver cell does. So if things aren't working well in the liver, they're also not working well in the kidneys. And so we're going to have issues there where toxins are recirculated. It's also going to affect the electrolytes. And once again, we have increased inflammation, suppressing detox. So we want to use binders. And this is where humic and fulvic acid may not actually be the best for our pets. Mind blown. They're not great heavy metal binders. And this is like the thing all of us are talking about. Use your humic fulvic acid, can help, don't get me wrong, but we need to use other binders as part of that. And I was mind blown also that so many pets, right? Who here has a pet with heavy metal issues through testing? Most people, yeah. And so a lot of times you'll hear cilantro, parsley, chlorella, spirulina. I've even said that, but fully admit to it. You have to give 90 tablets of chlorella to equal 1 scoop of this sulfur-binded silica that this company uses. I was like, cool, that's great. 90 tablets. It's going to go really well, right? Can you imagine giving Kai 90 tablets of
Well, I've had enough time getting to him to eat 3
yeah,
and they're
well,
little tiny
diarrhea it all out. So it's things like that where we have to look at these pathways. It's very complex. I tried to break it down as simple as possible, but essentially think about it. If things can't go the right way, it's like think about it like a car accident, right? Or it's wintertime, right? It's I-70. If anyone's ever been up to the Colorado to ski, I-70 is a great example. Every single weekend, this is what's potentially happening in your liver. Like something gets, like a car goes up there, let's see, a Mustang, up into the mountains, there's ice and snow, can't handle it. It slides out, blocks traffic. There's a huge accident. Everyone gets backed up. What do? They turn around, they try to get around it, and they're going the wrong way. So think about that. We need to clear that to get things flowing the right way. Otherwise, we're not getting the end result. You don't get to go skiing, right? Like that's a super simple like analogy. But think about like the liver and the kidney cells that way. And if those detox pathways aren't open, everything else falls apart. and it's essential. It's connected to the gut. It's connected to the immune system. It's connected to all, like everything. So I don't know if that helps, but honestly, hearing like Kai, I think we're using a lot of strong herbs for Kai,
Yeah.
like, and he's sensitive. So I think in terms of like what you're seeing, what you can always do is like lower your dosages of some of those herbs and see if he does better with that.
Okay. Well, I'm almost done. I think I've got 3 more days of the protocol.
Yeah.
And the only
So
thing
you
I
probably
can,
get through it and then
yeah,
you're good.
and then I figure I get through it, and then I'll just I'll do a few days of nothing extra, and then I'll do the Vengeance for a week
Mhm.
to kind of clear him out, and maybe keep up with some of the garlic at a lower dose for ticks and fleas, since he seems to like eating it. See if that
Yeah.
helps.
Yeah,
But
that sounds good.
he definitely was on the, grass mowing morning, incessant, and bleh, bleh, bleh.
Yeah.
I could
Yeah.
see. Yeah.
Yeah.
And it was
It's
just
just,
pure
you're
bile.
just, yeah, here's the thing. We're just using a lot of really strong, like it's strong herbs for him.
But I don't get that worried anymore when it happens. And that's the other thing to the group is anybody who knows me, Bethany, you'll remember, I used to panic. If Kai had diarrhea for 1 or 2 days, I was a wreck. If he didn't want to eat one of his meals, I was a wreck. If he didn't want to eat for 24 hours, I was ready to like commit myself. I mean, it was, I've over time, I've started to become a little bit more understanding and realizing, hey, I have days where my tummy's not feeling 100%. It doesn't mean that I'm falling apart just because I have one bad day. So one morning of throwing up bile, I'm not too worried. If he starts doing it daily, then I'm going to be a little bit more concerned. But I'm starting to kind of get it in that sense that I try not to panic right away.
Yeah, no, I appreciate that. So yeah, we're all in it together. We've been there. It's, and we're all on different phases of the journey, but it's one of those things too. These are why the principles are so important, because if we just start throwing different things at our pets, if we don't understand why we're doing something, like you can end up with a bowl full of supplements. And if your pet's really sensitive and we miss the point, for one, it's really expensive. Two, you could potentially have interactions with things. And we can create harm, especially if we start, I talked to a client yesterday and they literally were giving like 100 milligrams of zinc a day because of like the supplements were all overlapping with like zinc in it. And I was like, oh God, no, we need to this is not good. So that's what can happen is we start doubling up on things. And then you're like, why aren't they getting better? And it's because we're potentially creating like a toxicity in their body. So it's really important. It's not thinking about what to give. It's thinking about why is this happening? And then now what do we give? Because we better understand the physiology and the patterns.